Friends, today we move on to the letter Q, and we thought Q would be the questions or the queries that are posed to the doctor by the patients. One of the most important queries that come across to us at the very onset is, what is the success rate? Well, friends, the success rate is dependent on a lot of factors: the quality of doctor, the quality of the lab, and possibly most important, the quality of the gametes that the patient would give us. The second most important question that they ask is possibly, what's the cost? Now, cost varies from center to center, and there are so many factors which determine the cost. And the most important thing is possibly the quality of drugs that one uses, the quality of equipment that one has invested in, the quality of media that the lab uses, the quality of disposables that the lab uses. There are so many things which add on to the cost. In the air conditioner in your lab also adds on to the cost. The number of procedures that are done adds on to the cost. The third important question that most of our patients ask us is, what is going to be the duration of treatment? Unfortunately, there is not a standard answer for this. The duration of treatment is heavily dependent upon the nature of disease, how the disease is. Every patient is deemed to be different from the other, and hence it is very difficult to actually give a timeline for the entire process. The duration for an IUI cycle might just last for about 15 to 20 days, but in a case of IVF cycle might go on for a couple of months, depending a lot on whatever procedures that are done to reach the correct embryo. Also, another important question is, how much leave does one have to take? For a male, it is very easy for us to answer back. He just needs to be present on the day of pickup or on the day to give his semen sample. If at all it's a TISA examination or a TISA sperm retrieval, the male could join back work the very next day. But when it comes to female, the ladies have to come for regular ultrasounds. That too, it's just a half an hour procedure, take her injections and go back. After a ovum pickup or the oocyte retrieval procedure, the lady could actually join work the very next day. Unlike earlier times, the stress of IVF has reduced considerably on the couple in terms of physical impairment, and hence the question as to how much leave one requires has now actually come down to the answer that it is very minimalistic as far as leave from work.